Hello, my name is Whitney Correa, and I'm going to speak with you today about barrier methods of contraception. There are four m- main barrier methods that are both chemical and physical barriers. The main purpose is to prevent sperm from fertilizing eggs, and most of them are best used with spermicide. The first one we're going to talk about are condoms, which decrease but not completely eliminate the risk of STIs. You want to place it on an erect penis, leaving a little bit of room at the end to collect semen. When removing the condom, you want to hold it towards the base, towards the tip, so that way nothing spills out. Um, some of these condoms have already come equipped with spermicide, but if not, it's always a good option to use that with them. Um, they can tear, so you want to be careful putting them on. And they come in either latex or non-latex variations. The next one is spermicide itself, which is a chemical barrier, which means its main job is just to kill the sperm. You want to insert it into the woman's cervix about 15 minutes prior to intercourse. It comes in gels, creams, films, suppositories, foams. So either, in any case, you don't usually need a prescription for that, and you could just find it over the counter at any one of your drugstores, and use that. And it's usually best used with another form of birth control um, or contraception. You don't want to exceed using it twice a day because it can increase your risk of HIV, and it is good for about 1 hour after it is inserted, and you have to leave it in for at least 6 hours after intercourse. The next one we are going to talk about is diaphragm, which is a female condom. This does require a prescription. It's a dome-shaped silicone cup, silicone around the rim, and it's similar to the menstrual cup, which you might be familiar with. You want to insert it into the cervix, and it needs to be properly fitted by your gynecologist or your provider. Before you insert it, you want to put the cervical side and the rim with, you want to put spermicide on that, and insert up to 6 hours prior to intercourse, and it must stay in 6 hours after, but no more than 24 hours. If you're going to be using it for more than one act of intercourse, you want to reapply the spermicide and empty your bladder prior to insertion. You want after you insert it, after you remove it, I'm sorry, you want to wash it with mild soap and water and reuse. You replace this every 2 years and refit it after 20% weight fluctuation, whether you gain or lose, if you have any abdominal or pelvic surgery, and after every pregnancy, it will need to be refitted. The next one is a cervical cap, which is made of silicone rubber. The cap fits tightly at the base of the cervix and creates a physical barrier that comes in 3 sizes. Um, this is also, I believe, prescription. You can insert it 6 hours after, 6 hours prior to intercourse, and you want to leave it in about 6 hours after as well. It's very similar to the diaphragm, only you can use this up to 48 hours, but it is not for patients with abnormal pap smears or with previous history of toxic shock syndrome. And leaving this in for more than 48 hours can also increase your risk of developing toxic shock syndrome. And the last method that I have here for you is the sponge, the cervical sponge. It's a small, round, concave polyurethane sponge that creates both a physical and chemical barrier. It's a one-size-fits-all. You want to wet it like a normal sponge and insert it into the cervix. Leave it in place for about 6 hours, at least 6 hours after, and it can provide up to 24 hours of protection. This is also runs a risk of you developing toxic shock syndrome if it is left in place longer than that 24 hours, and it is not reusable. You want to dispose of this when you are done. Okay.